So our 9 health expert, Dr. Payal Kholi, joins us now to give us a little bit more context. Good afternoon, Dr. Kholi.
Hi, Steve. Good afternoon.
Good to see you. So we have heard that COVID-19 is going to become endemic. Let's talk about the difference between pandemic and endemic. What does it mean?
Yeah, so if you think all the way back to the beginning when we talked about these terms, so an epidemic is an unexpected surge occurring in one single geographical area. When you start putting it in a wider area across countries or populations, you call it a pandemic, and it's all about the spread of the infection. So it's an uncontrolled, widespread increase in the number of infections. And when you shift from pandemic to endemic, what you're really talking about is a more manageable level of infection with more immunity occurring in the communities. It doesn't mean you've completely eliminated the infection, but it just means that it's gone from being uncontrolled to being a little bit more manageable.
We've heard voices out there say, pandemic's over, this is now endemic. When will the shift actually happen from pandemic to endemic?
You know, a lot of public health leaders don't think that it's coming imminently, that it will take several weeks, if not months, to happen. And of course, a lot of government organizations want that shift to occur. We all do, because we want to sort of get our lives back to normal. But I think the way to think about that shift is when we have a controllable number of cases. Usually that means a low rate of positivity, or that the number of cases is not continuing to increase. So really sort of hit a steady state number of cases. And as I said before, there's widespread immunity occurring amongst people, so that we kind of stay at that steady level. We're not doing the peaks and troughs that we've seen throughout the pandemic.
So, you know, we've been following along, and you've seen the graphs that we've put on TV throughout the course of the last almost 2 years now. Cases, hospitalizations, positivity data. What do you think the metrics that we will need to, or what should we be following now, and what should we be following in the next 6 months?
Very interesting question. So, you know, total cases to me are no longer as instructive, because we have all those at-home positive cases that we're not counting. We also don't really think we should follow hospitalizations anymore as the main metric, because we know that people can get in the hospital and get COVID, or get in for other reasons and then have COVID. And similarly with ICU beds, we've got elective surgeries, we've got all these other reasons why people might be occupying ICU beds. So I think we really need to move our metrics and our thinking from the hospital to the outpatient setting, to the clinic. And I think we should do what we do for the flu, for example, where we follow how many respiratory-like illnesses did people present with, and how many of them ended up being the flu. And that's kind of how we track that activity. We need something similar for COVID-19. How many people are presenting with respiratory illnesses, cold, sniffling, sore throat, and how many of those end up being positive for COVID-19 in the outpatient setting? That will tell us what is happening in the community.
All right, Dr. Payal Kholi, we appreciate chatting. It'll be interesting to see as we move into that phase, if we start talking about COVID-19 like we would the flu. Appreciate your time. Thank you.